Hello, everybody, and welcome again to another episode of the Risk Matrix with myself, Dr. Martin, and James Junkin. Hey, James.
Hey, it's been a rough start to football season, but roll tide, baby. Roll tide.
You know, I got harassed today, I told you, at the dump about the coach here and whether or not Alabama should keep him. But as you can see, I'm staying true. I've got my crimson on, and I'm going to say roll tide, but we need to start winning, and the record doesn't look that good.
It's not, and if I have to, I wouldn't want to, but if I have to give up my seat here as your co-host of this podcast and coach the Crimson Tide, I will do so for slightly less than the $62 million we owe if we have to buy his contract out. So I'll do it for 30 million. Then when
And
I
I'll take over
retire,
the
I'll come
podcast by
back to the
myself.
risk matrix like Saban went to game day, baby.
Right. After the season's over.
After the season's over, indeed,
All right. Well,
indeed.
let's get into it today, James. We've got a good topic today. We're going to talk about risk matrices, and if you guys don't know what we're talking about, basically we're talking about the red, yellow, green boxes that we all like to put in our uh, JHAs or in documents that go into the field, all the pretty little stuff that we like to put in there. But we're gonna talk a little bit about that, and we're gonna be very real when we talk about these risk matrices. Before we do that, James, little word about our sponsor, which is Veriforce. We're powered by Veriforce, but let's say we're sponsored by them because we have a booth coming up at NSC in Colorado, in Denver. And what booth is that?
I think it's, what did we say, 3,100?
3100, booth 3100 at NSC
3,100.
Congress.
I will not be. I had a scheduling conflict this year for the National Safety Council, but the Veriforce team will be there. Several of our strategic advisory board members will be there. Dr. David Daniels will be speaking on topics related to psychological safety and mental health. So I know he'll be there. He's got a new book out. I'm pretty sure he'll have his book with him, do some signings. So, hey, if you're going to be in Denver, wish you the best. Hope you come by the booth. Check out Dr. Daniels and his new book and all the exciting offers that Veriforce has.
Great. Thanks, James. And I agree. Come see them at the booth. Talk to Veriforce about the stuff they offer. See the strategic advisory board members and get in some good professional development. So let's start
Absolutely.
with what's in the news, James. Give me a little bit of our topic today for what's in the news.
Bad news out of Texas. Trinity County, Texas. A lot of you have seen this broadcast on LinkedIn, other social media platforms. 3 workers dead in a manhole due to exposure to H2S. And these really hit home because this happens at least once a year in the same type of scenario where someone goes into a confined space. There was either no monitoring or inadequate monitoring. I don't know the facts. It's still under investigation. I'm sure we'll learn all the facts as the investigation unfolds. But based on the new news reporting, you either had no monitoring or inadequate monitoring. Somebody goes in, they get overcome by H2S or potentially a low oxygen environment type situation. They get in trouble. Somebody springs into action and tries to help. They get into trouble. Somebody else springs into action, tries to assist and save their coworkers, and you end up with multiple fatalities. And this has happened time and time and time and time again in these same scenarios in manhole covers and going down manhole spaces.
So let me just jump in there, James. A fatality at any point, any type of fatality is always a tragedy when it comes to workplace safety. This is a pet peeve of mine. Inadequate investigation of confined spaces or spaces in general. Inadequate investigation of environmental problems, inadequate investigation or consideration for hazards that might exist that maybe aren't in your wheelhouse. And let me explain this a little bit. You know, my background's in environmental investigation. One of the things that environmental investigation is, it's a hallmark of what you do in environmental investigation, is you do a really good background check of what a property may or may not have been used for in the past, considering the present, but also considering the past, considering what's around, what could be contributing to an environmental hazard, so that when you go and you investigate, or you go and you do work within a property or a problem, right, you know
Right.
what to look for. And I feel like in these confined space deaths, and in a lot of these confined spaces where people succumb to any type of hazard, H2S just being one of them, we tend to think as safety professionals, or even as an employer, right, that we can take a 4-gas monitor and throw it in a hole, and if it reads a certain thing, we're all set. Okay, there's a couple of flaws with that. One, you make sure that monitor works, make sure that monitor's calibrated, make sure the alarms are set for what you need it set for, which possibly in this case, I don't know the case, could have been a problem. But also, you need to be looking for things with monitors that go beyond a 4-gas, right? You're not
I
just
agree with that.
you're not throwing a 4-gas in the hole. And, you know, again, there are a lot of problems here that could have arisen. The use of just a 4-gas monitor, the not monitoring for the right compounds, not monitoring for the right levels of compounds, not monitoring at the right level within the space for the compounds, okay? Which is especially apparent when we have these H2S fatalities.
Absolutely. And you know, an H2S monitor is going to monitor, I mean, a 4-gas monitor is going to monitor for H2S. It's one of the gases. I'm not saying that that is what the gas was. That's what's being reported. Once we get facts from an autopsy report, the investigation's complete. I'm always hesitant to jump on the first reports that come out of an incident, because most of the time they're wrong. They're incomplete in facts and data. But I've seen this repeat itself. And experience tells me that if we're talking about H2S, we're in an active sewage situation, we're going down in a manhole, there's a likelihood of H2S exposure. So don't know if there was monitoring before, or there was entry. Don't know if there was monitoring and it was ineffective monitoring. We don't have enough facts yet to make some determinations about this incident. But I can jump in with you and say there's a commonality in previous incidents. And the commonality is usually there's a lack of training to a specific standard. There's a lack of execution when it comes to monitoring and going into confined spaces. And there's a lack of discipline, which is preparedness in emergency response situation. 60% of all people who die in confined spaces are would-be rescuers. I don't know that's the case here, but I'm not going to be surprised to find out that victims 2 and 3 went in to help victim 1. Okay.
Or let me give you another scenario here. Or that continuously monitoring wasn't being done, right? Because in a lot of these situations, you will have H2S at a certain level, but you may have, in an active sewage situation, or even in an active oil and gas situation, you may have an inrush of a gas because of the way gas releases from either the formation, if it's
Right.
oil and gas, or within the piping system in a sewage treatment or sewage situation. And so prior knowledge of what the high and low levels could be in those situations might have been, if H2S was the problem, might have been something that could have saved the lives of these workers.
Further down this news article, while we were talking, I tried to do a little bit more research. Again, this is early on, nothing official. While completing their assigned job, The person being interviewed said one man went into the manhole to stop sewage from backing up into their work area. He said the worker fell unconscious, another went to help him. Then a third went in to try to save the other two. At that point, the gas overcame him as well, with his alarm going off on his gas meter, which said H2S, which was hydrogen sulfide gas. And so, there's still a lot of details. Entering confined spaces is very hazardous. If it was on a risk matrix, like we're going to talk about, we would be talking at some of the most severe levels when it comes to severity scales and probability scales. Follow processes. Another thing, I sit on the ANSI Z390.1 committee, and maybe we need to do a whole episode about H2S, H2S training, what's required by the law, and what's recommended by the folks that deal with H2S all the time. Maybe we need to go back and do an episode on that.
I don't think that's a bad idea. I think I can give you some recommendations, and I'm not on the committee.
As to what sound work practices are. But one of the things I come up with a lot in the classes I teach when it comes to H2S is a monitor is not PPE. Not saying it's the case in this particular incident, okay? I want to be firm on that. I'm not judging this incident because I'm not investigating this incident, but I'm just reading that said the worker died and his alarm was going off and his alarm said H2S, okay? That ought to tell us all something, because I hear companies all the time saying, well, what are you doing to protect your workers from H2S? Well, they have a monitor on. Well, you can be just as dead with your monitor going off, right?
It's too late.
It's too late.
When you have a personal monitor and the alarm is going off, it's too late, right?
It's not a control.
Hopefully what will come out of this is that they were monitoring and there was some other issue that occurred because, in my mind, we shouldn't be talking about personal monitors. We should be talking about the continuous monitoring and the hazard identification before they even entered this space, and the discussion that occurred before that. So let's move on for that, because we can beat that until we're silly. Let's move on to our discussion of risk matrices. And again, when I'm talking about risk matrices, and for the purposes of this discussion, James, you can correct me if I'm wrong. We're going to talk about the pretty yellow, red, and green boxes that people like to put all over stuff and
the
say
5x5, standard 3x5 risk matrix,
4x4, whatever, and they go on these documents to people in the field. And go ahead, you start us off, James.
Well, you see a lot of this, particularly when you're in school or in advanced training classes in occupational safety and health, as a tool utilized to determine severity and probability in some type of ranking system. I got a call this past week from a listener of our show that's in his PhD program, wanted to talk about risk matrices and my opinions related to risk matrices, whether they're quantitative or qualitative in nature. And I had to use your line. It just depends, on the person who's completing it. But risk matrices are meant to determine and alert people to the level of risk associated with a given activity to ensure proper controls are in place, but also to make sure that proper permissions are in place.
So I'm going to use a line from you. It's too late to draw it up in the dirt.
That's right. You can work up to this, but if your risk level goes above into these red areas or yellow areas, you have to stop the job, and let's talk about additional controls. And so, as a practitioner, I think this is just James's opinion. It's not Veriforce's opinion. It's not Dr. Martin's opinion. It's just James's opinion. Risk matrices are better used in the planning of the work, where hazards are best identified and controlled. And it takes a very mature safety management system for frontline workers to utilize risk matrices properly.
Amen.
They
I
just
agree.
end up being something on a document that enhances the color scheme for it if not used
Right,
properly.
makes
It
you
looks
makes you
cool.
need to buy a color printer in order to print out your JHAs for the field
Indeed.
people to review. Um, so let me just go back, and I'm using your line on this, James. It's too late to draw it up in the dirt after you're out there, and you mentioned stopping the job when you get up in the red and yellow. In my mind, the only time you should get up into the red and yellow is if there's something that's unanticipated. So putting something red and yellow on a document that goes to the field is not helpful at all, unless that task is a high hazard task and you want to alert the workers to the fact that they're still in that high hazard zone regardless of the engineering controls, PPE, administrative controls, whatever that you have in place. Okay. So in my mind, it pretty much doesn't belong there, because most people will be in that zone, that are in that zone, are doing those kind of risk matrices analyses in the office as part of a HAZOP review or as part of a high hazard task review with the workers before they even set foot on a job site.
I'm gonna agree with you, and I'm probably gonna get a lot of flack for what I'm about to say. Um, but that's okay, man. That's a great thing about safety. There's not an OSHA standard called risk matrix, right? So now it's just everybody's opinion. It's everybody's opinion when it comes to how to use the tool. So let me preface my remarks by saying this. If you're using this visual tool and it works for you in your organization and you're identifying hazards and you're putting controls in place and you're bringing workers home safe for high hazard jobs, then by all means, keep doing it. Okay? However, I think there's often a tendency to get enamored with the tool and not with the process, right?
Well, I can
Or
tell
the
you who's
intended
not
outcome.
enamored with the tool: people in the field.
The people in the field are not enamored with the tool. I often find, and I get very defensive of the frontline worker, because the frontline worker is the person who has to go out there and get the job done. They're the ones that encounter the hazards. They're the ones that get hurt, and they're the ones that potentially die when our safety management system doesn't adequately anticipate, identify hazards, and put in right controls. And we're really good at pointing out the failures of the workers without looking at the failures of the system itself. And I feel the same way about JHAs. I said this at the OSHA Oil and Gas Conference a couple years ago. I thought there was going to be a riot. I was going to be tarred and feathered. But here's the truth. The JHA, the JSA, the JRA, the pre-task plan, whatever you want to
Method
call it,
statement.
right? Based on OSHA publication 3071, job hazard analysis, when implemented correctly, should be the tool that we utilize after a long line of risk assessments and hazard identification and control discussions, right? It's our last document, our last step before we go to work and actually encounter the hazards. And then when there's an incident, we're often quick to grab the JHA, JSA, whatever your terminology or acronym you want to use is, and then point out where the workers didn't do this, they didn't do that, they didn't do the other, as if that practice just started that day. If the workers could identify all the steps, right, know all the steps to do the job, identify all the various hazards, then walk through OSHA's hierarchy of controls, implement it at the highest level of control possible. If they can do that without guidance of management and safety professionals, what do we need y'all for? You don't
Okay,
need
well,
safety professionals. You
I'm
don't
gonna
need management.
I'm gonna
Okay?
disagree a little bit with you here, because I think we're going down this road of should we spoon feed things to our field staff, to our frontline workers? I don't think that's the case at all. We shouldn't be spoon feeding everything we do in management, like creating the JHAs for them and ensuring that all the steps are in there. We are part of that process. But
Hmm.
that process goes on before we reach the field, such that what the worker should be concerned with are there new hazards? And do they have the tools in their toolbox to identify the new risks, the new hazards, and the opportunity to stop a job, to add to that JHA, to call in help, to do all those things, right? So I just want to make
I mean,
clear that
I
I'm
agree
not a,
with you, but let me say this.
I'm
Here in
not
the
a
real
fan of,
world, I look at hundreds of JHAs, hundreds of JHAs.
as do
Out of
I.
that 100, there might be 5 that have adequately identified existing and predictable hazards. Here's why I see on JHAs. That's why I got in trouble at the OSHA Oil and Gas Conference for saying this. Bee sting, not saying bee stings ain't important. Heat stress, not saying heat stress is not important. Slips, trips, and falls. But we forget we're about to lock and tag out a, a, a gas pump. We're about to do hot work on a piece of pipe that had some mixed hydrocarbon on it. We're going to go down into a confined space like a manhole. I'm great we got bee stings and slip, trips, and falls, but we're missing the stuff that is actually killing people. Most of these documents are a mere formality, and we just complicate it further by putting an advanced level of risk assessment tool on a JHA that people already struggle with filling out. And
I'm
this is
going to
why I
tell you
said
what.
it got me in trouble. I
If
don't care if they do JHAs or not, because if we had done our job correctly, we've already got the hazards identified, the controls in place, and all that's missing is what you just said. Something new pops up. Something new pops up. Because 5 out of 100 JHAs, that means 95% of the JHAs I look at are missing the major hazards. And it's just become a paperwork exercise to meet some requirement to have it.
So let's talk a little bit about where these pretty little boxes belong, or the tools that we have several books now of, 50, 60, 100 tools with all the different colors and all the different types of analysis that we can do in order to identify risk or assess risk or quantify risk. We've got all these books out there that we can use for these things. Where do I think it belongs? I think it belongs on the risk register, number one. And I think it belongs in high risk tasks, higher risk tasks like, you know, locking and tagging out a pump, or, uh, you know, making sure hazardous energy is controlled in other ways, or confined spaces, or high risk jobs where we've got to use big time engineering controls in order to
Yeah.
mitigate risk. Okay. So these things belong in the HAZOP, maybe as
Yep.
a discussion. They belong in risk registers as a discussion. And don't get me wrong, some people, risk registers, they look at the risk registers as a company scale risk tool, you know, business continuity,
Right.
or stuff like that. But I think what belongs on the risk registers are our high hazard tasks that we're doing in the field as well. Have
Well,
we added?
certainly, I'll concur with that because those high hazard tasks, I mean, we're getting back to a change a little bit in the thinking of safety professionals. When you're saying that, rolls back to me, the focusing on the stuff that will kill you, the stickiness of it, a shift away from minor injuries into SIF and PSIF and those type of prevention techniques. And when I think about a risk register, we're talking about risk beyond occupational safety and health risk. And occupational safety and health risk can lead to reputational risk. It can. We had an incident everybody goes back to the BP oil spill, but they're not the only company that we could draw an example from where you had a major incident that resulted in fatalities. But everybody's forgotten about the 11 people that got killed in that, but they all remember the environmental disaster, right? And the environmental disaster is what resulted in the reputational damage to BP at the time and the removal of their senior executives. So all of that should take place in the planning of the work, in the design of the work, and I think is where formal risk matrices are also appropriate. I'll add one to it: simultaneous operations. In a company where we manage their safety, I have to really commend the management of that organization. When we first went up there into North Dakota in 2012, it was like the Wild West. I mean, it was crazy. People didn't know what PPE was, nor did they want to wear it, much less JHAs and things. After a series of a lot of minor injuries, they made a commitment to try to turn it around. They turned it around. And even though TRIR is not a barometer for future success, let's just say it's rare for them to have an OSHA recordable injury. But for a span there of about 3 years, we had some significant near misses that had SIF potential. And what I found was we weren't adequately dealing with the risk of working with other companies. And that spilled over, and we didn't have a really defined process, for example, whose policies we were going to follow during a particular evolution, who was actually in charge and could make a decision when we needed to stop the job, and that was an elevated risk. So one of the things that we did as a countermeasure to that, believe it or not, we implemented these formalized risk matrices, 3x5 scale risk matrices, that we utilized in the planning of the work with the other companies to ensure that we had control.
That's like a HAZOP discussion, right? That's a pre-work discussion. But let's also include simultaneous operations by the same company.
Okay.
When you first mentioned this, I mean, I get where you're going with having, several companies working around each other. And this is something that I preach, when you're not the GC, or even if you are the GC, that your safety meetings in the morning should also include not only the hazards of the work you're doing, but the hazards around you. Are there electricians working in the next room? Are there, is somebody going to come in here and open that panel and we're going to be at risk of arc flash? Are we somebody's going to be generating hazardous dust, or they're going to be working with hazardous materials? Are they near us? Will it affect us, right? So yes, simultaneous operations for that, but I have companies that do simultaneous operations of their own where they're impacting each other, either with silica dust. Somebody's not working with silica dust, but they're not wearing the respirator because that's not their task. But next to them, somebody's generating a lot of dust. They're doing grinding work or chipping or whatever, and they need to work near them, and they need to do their job. So they need to have the same level of knowledge of the hazards that are going on in their work area. So let me just add on to this a little bit, right? People who love these red, green, yellow boxes, and they love to put severe, medium, low risk on the JHAs, which I've already established that I think is not needed. If you want color on your JHAs, if you love color and you want to buy a color printer and you want to have something called out to workers in the field, here's what I think you should do. If you want that little box there, in the little box, put the highest hazard risks spelled out with the mitigation that needs to go on from the field that we haven't implemented as a matter of course, that the field workers need to call attention to as the sticky of their work. If you love color, make it red. Make the little box and put sticky up there if you want, or put whatever you want to call it, high hazard risks of the task or whatever. But as far as I'm concerned, I don't need your red, yellow, green boxes. And I don't think the people in the field need it either. Well, I think that what the people in the field need is hazard identification training.
Yep.
I think they need to have knowledge of what they do and don't know. I think they have to have knowledge that they can stop the job and run it up the flagpole and get help. I think these are the things that are important, not that we're alerting them with some tool that really has no effective use for them. Just my
Yeah,
opinion.
I tend to agree with that. That the best use of this is not at the field level; it's at the planning level, right? And one of the things that comes up when it comes to establishing formalized risk assessments is everyone that gets into this needs to acknowledge that different companies have different tolerances for risk. Okay,
Amen.
and James's tolerance for working around live electricity is zero. None. Okay? I don't know how it works. It's magic. You know, how does electricity know to go back to where it came from? I don't know. It's magic, right? But if I worked for, let's say, an HVAC company that has to deal with live electrical work all the time and has qualified electricians, their tolerance for risk when compared to what the OSHA regulations are and the National Electric Code and all that, their tolerance for risk is a lot higher because they deal with it all the time as compared to the general public. So what's my point? There's a lot of subjectivity in what severe means. So I'm gonna say what you're
Go
gonna
ahead.
make
I'm
me
gonna
say
let
it,
you
right?
say, but I get you see I'm smiling. I got some stuff to say.
It just depends.
It just depends.
It just depends. And so I think it's a useful tool in the planning of the work in HAZOPs and things of that nature. Sometimes it's required. Uh, you said something I also want to piggyback off of, but I want to go a step further. You know, when we talk about another way that I think this could be helpful, where workers have the right to stop the job, I think where what these tools could potentially provide a lot of assistance is when they must stop the job. We're not telling you you have a right.
Put
We're
it in
telling
red
you
in
you
that
can
little
go to this
the
point
little
right
dot.
here and you do not proceed unless you have authorization from the vice president of safety, the vice president of operations, or the owner, or whoever. You don't have the right to make the decision to proceed any further because of the risk tolerance of our company.
So let's talk about risk tolerance because this is goes back to simultaneous operations, whether it be simultaneous operations of a same company or of a multi-employer work site where people are doing different things. You know what should prevail? Whose level of risk should prevail? Well, first of all, that's a discussion that needs to be had, you know, in the designing planning phase of the work, the kickoff meeting or the GC meeting when we talk about who's going to be doing what at what time and around who. There are places where the person who says it's the most severe risk, that's who we go with, right? With electrical. In other cases, operations need to be rejiggered so that they can be done at different times and we don't impact other workers. And
That's right.
sometimes the most hazardous activity needs to prevail. And it's too late, what, James, to draw it up in the dirt after an incident has happened or we're just getting ready to start the job to have those discussions.
And I see it all the time. That's why, especially on the construction side of the house, when you got multiple trades performing some type of work, particularly when we're talking about new construction or massive maintenance operations going on, like turnarounds or outages. I can't tell you the number of times you've had workers working down here, and then sparks from grinding activities are coming down on top of these workers. Now, why did that happen? Because we didn't do a good job in planning. Both teams need to get their job done. It's not their fault, right? And once you get out there, now you've got people with operational pressures, with deadlines, having to make decisions at the ground level, where that should have been something we talked about a little further up the food chain in the planning of the work. Same thing when it comes to certain activities. I would say even designing the work site, laying out where we're going to put lay down yards, where we're going to put the bathroom facilities, where the
Where
muster
traffic is
areas and
gonna
things
go.
are,
Where traffic is gonna go.
where
What are the main
traffic is going to
pathways?
go.
Where are people gonna walk?
And I don't necessarily need to know this piece of paper, which some people find useful. And again, if it's working for you, but if I'm going to put, I don't really, do I really need to chart this out to say, if I put these porta potties next to a high traffic area where we're running material handling equipment, that the likelihood of somebody being struck by a piece of heavy machinery is pretty high up in the color scheme of my chart, and the severity is catastrophic. I don't necessarily have to do that for that. And I think sometimes we get bogged down in developing these things, in using these tools when they can be used for more complex operations. Let me just put it that way.
So I got another comment too. Why do we even have red on that chart? Why do we even have red on that chart? If
Because
we're
we've been
supposed to,
conditioned, green is good, yellow means caution, and red's what?
red means death, danger,
Danger,
people dying.
stop, all
But
these other things.
here's the thing. If you're in a high hazard job such that you're in that red zone, the planning is going on long before you're going to put red on your document and for the field, right? So in my mind, we don't even need red on probably 95% of the documents anyway, because we
That's
should be
right.
putting ourselves solidly in the green or in the yellow with some cautions. But anyways, we can beat this subject to death.
Well, let me add this one last thing to it, okay? If you're going to utilize these tools, this is one of my gripes about safety professions. Be reasonable in your assessment. Not everything is high risk and as far
High
as
probability.
some high probability and high severity. Not everything we do, and you can worst case scenario this to the point where we can't even get out of the truck. So as you're utilizing these tools in the planning of the work, be reasonable. And if you can quantify it by going back and looking at incident and accident investigations, we do that. We actually look at the investigations and see what the root causes or causal factors were in certain instances. And if you say in this activity over the past X number of years, 30% of the time we go out there, somebody ends up with their hand cut. But you know what? We need better controls. We need better controls. So you've got some quantitativeness behind it. But
So before
I
we close
expect
this
them very
discussion, I want
subjective.
to say one last thing, James.
Mhm.
All those people that wrote books on these risk tools, I'm not saying they're not useful. I'm not saying they don't have a place. I'm just saying they don't have a place in a field document. They don't have a
That's what
place.
I'm saying. I'm saying that too. I don't want anybody to get the idea that I'm just totally discounting the usefulness of risk matrices. Our podcast is named the Risk Matrix. All right.
Right.
There's a usefulness, but it's usually up at the higher levels of the planning in the organization of the work, and not at the sharp end of the spear.
And in a team atmosphere where work can be identified and quantified with a bunch of different opinions on what the hazard level is, right? Because we can get closer to what actually exists and what the actual risk is if we have more minds on the job before we start the job and we're discussing how the job is going to go. So at any rate, this has been a vigorous discussion. It's one of our better discussions, I think, James. And I just want to give a shout out to the people who are going to be mad or upset about some of the opinions. These opinions are our own. They're not Veriforce's opinions. They're
Right.
just opinions from several years of doing what we do. But by all means, if you disagree with us, there are places that you can go to tell us about it. James, tell them where they can go.
Hey, man, we're everywhere now. We've got our own LinkedIn page, the Risk Matrix Podcast LinkedIn page. Jump over there, throw some comments down in under this particular episode. We'd be glad to engage with you in a respectful and professional manner. We're also there on VeriForce's YouTube channel. We're on Spotify. We're on Apple. Dr. Martin and I are both very active when it comes to LinkedIn. We've got email addresses. Join the discussion. That's how we get better. Any safety professional that says they've not changed their mind on anything in 30 years, I'm not sure I really want that person to be part of my inner colleague circle, right? I've changed my mind. I could be wrong about this. It's okay
Probably
to
not.
have a discussion because
Probably
all of
not.
us are seeking to do the same thing. And that is to improve workplace safety and bring people home from these hazardous jobs. That's our passion. That's why we do this. And we'd love to have you part of the discussion.
So thanks for listening. And if you're going to NSC in Denver, visit VeriForce at booth 3100. Come see some of our strategic advisory board members. And until next time, I'm just going to say it just depends. And James?
Hey, roll tide, baby. We may be calling y'all for a buyout of our coach soon. Roll tide.
Roll Tide.
Out.